of our COVID-19 kit initiative, today we will be talking to Dr. Wafaa Abdel Hadi, who is the first certified functional medicine doctor in Egypt and in the Middle East. She is graduated from Qasr Al Aini School of Medicine, Cairo University, where she has dreamed all her life of becoming a doctor and heal people from their diseases. In April 2014, after 13 years of practicing clinical oncology at the most reputable cancer centers in Egypt, and in collaboration with Institute Gustave Roussy in Paris, she has decided to establish a WARE clinic for cancer awareness prevention and genetic counseling, introducing the anti-cancer lifestyle concept to the community. Why wait to get cancer when you can prevent it? Pursuing her new career and passion in functional medicine in collaboration with the Institute of Functional Medicine in USA, which is in simple words means finding the root cause of the disease in order to reverse or improve it. Aware Clinic encourages lifestyle modifications through offering individualized protocols for each patient where there is no one magic pill. Hello, Dr. Wafaa. Thank you so much for doing this for MPEAL and their listeners, and everybody who are currently stuck at home and, you know, under the lockdown. There's so much of pressure on everybody, and so we just want to bring the best of content to people to help them. And thank you so much for so generously giving us your time.
Oh, thank you for having me. It's always like a pleasure to talk about what's best for people's interests.
Yeah, and you're a fantastic speaker. I absolutely love listening to you all the time. I can keep on listening to you. So my very first question is, how did you end up with functional medicine coming from clinical oncology?
Well, this is like a hard question, but like in a nutshell, I've been doing like clinical oncology since 2003. So I've been seeing like in the faculty of medicine, you just see like 65 to 100 patients per day. In the private practice, you see like from 20 to 30 patients per day. And they all come, you see their scans, you see their labs, it's fine, take this chemotherapy, oh, you're vomiting, take this medicine. But they always come back with a recurrence. Only the lucky ones who don't come with a recurrence. So I just said to myself, so why do they come back with a recurrence? So I met this naturopathic doctor from Arizona, and she told me, listen, you will not be able to understand why what I'm talking about until you take health coaching. So this was the very first time for me to hear something about health coaching and naturopathic medicine, etc. You know, coming from like Egypt, and you don't like, you know, we don't have these things here. Like you can find it in India, you can find it in the States, you can find it, of course, in Germany with the anthroposophic hospitals. However, I listened to this, I took this health coach program, and then I found out Dr. Mark Hyman talking about what's functional medicine and knowing the root cause of the disease. So I said, that was my aha moment. Like, yeah. Why would three people with the same, with breast cancer, for instance, getting treated the same? They are different age, they are have different genetic profiles, they have different, you know, chemical reactions going inside their body, different detoxification for their estrogens, etc. So that's how like I fell in love with functional medicine. And to tell you the truth, like it's called functional medicine, but at the end of the day, it's like integrative medicine.
Yeah, very much.
Just integrate everything together for the better outcome of the patient. You know, you change their lifestyle, you change what they eat, how they think, what they breathe, and then you modulate the genes. You just fine-tune their life in order to get the better outcome.
Yeah, absolutely. And personalization is the key nowadays.
Yes, absolutely.
Hopefully we're starting to understand that personalization is absolutely the key. So just thinking of that now, you mentioned the eating, the environment and all that. Currently, we're in in a situation where extremely high stress, there's lack of sleep, a lot of mental health issues. We are stuck at home, not always you can eat healthy eating, and particularly movement is very restrictive. So there will be what do you think? What is your view on the long-term health implications of this?
Well, people have to understand that actually stress is harmful because we're very stressed all the time. So they have to understand there are a lot of papers talking about stress and neuroinflammation, brain inflammation, and that when you stress for 1 hour, your immune system is like the sympathetic overflow gets
Mm.
beyond the vagal overflow. So your immune system is literally paralyzed and to promote more inflammation. And then the stress makes you binge, like binge eating. Is
Mm.
it called binge eating, right? Or
Yeah,
yeah.
yeah, binge eating.
So yeah, so binge eating is mainly sugars and high carbs.
Mm.
So high carbs and one sugar. There is this 1973 clinical scientific paper about when you eat one spoon of sugar, it stops your immune system for 5 hours.
Wow, wow.
So I did this like very short interview in Arabic about stress, sugar, and sore throat.
Wow,
Because
imagine.
stress reactivates the Epstein-Barr virus, which mainly lives
Yeah.
in the head and neck.
Mm.
And so people, when they got a lot of sore throats, a lot of coughing, etc., and now like everyone who coughs beside you, you just run away from him. Who's coughing the first time. So stress actually reactivates Epstein-Barr virus, and it causes like sore throat, coughing, and like discomfort. And if you continue with the stress, etc., it might even cause an upper respiratory tract infection.
Yeah.
We
Yeah.
have to be very careful with the stress. We have to know
Mm.
how to get the stress out to increase your vagal tone. Do meditation, exercising is of utmost importance because it increases your oxygenation and it improves your serotonin and it combats stress at the same time. And
Mm.
I'm not asking people to like run in the streets and so we will have a marathon every day. And we need to keep 2 meters distance now. It was like 1 meter, now it's 2 meter distancing.
Yeah.
But I'm just talking about brisk walking.
Mm.
And for obese people, they just walk. And
Mm.
if they can go like because now pools, like I would tell obese patients to go to the pool, but now it's not
Mm.
allowed. So it's
Mm.
just walk, walk, and walk. There
Yeah.
is now the new era of home sauna, where
What's
you
that?
home sauna.
Yeah. How like you
Can
can
get a home sauna,
home
yes,
sauna.
but made from wood because when I told one of my patients, now she lives like that, she got the one made from plastic. So the one
Oh, okay.
plastics, and the
Yeah, heat and plastic.
yes, yeah. So yeah, I was like, oh, please don't. So one should be very careful about what's commercial and what's real, and always go back to nature.
Mm.
So if you don't have a garden and you have a balcony, grow some like veggies and some like parsley, greens, so that you can have your daily greens fresh, organic, and not sprayed, with
Mm.
insecticide.
Mm.
So you just need to optimize your meditation, your breathing, and I know that you were going to ask me about humming.
Yes, that is my. I was about to ask you about the humming now. That's a very interesting point you talk about. Practice of humming and different techniques of breathing. If you could explain that a little bit more, that'd be brilliant.
Yeah, so basically, so my little kid has like sinusitis, okay, and he has this nasal tone. So I was just like googling and doing all this stuff, and I found a paper about humming it improves your chronic sinusitis because when you hum, you do like you have like in India they have the mantra, the
The
hum,
om,
yeah, the
om,
yes, the
yeah,
So when you do in
yeah,
the tone, yes, your ears, so your mastoids, your
yeah,
here and there, it vibrates. So you
yeah.
you 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 have to test the tone that makes your oscillation, the vibration in your sinuses vibrate the most and stick to it. So I
Right.
was, and you can do it like 10 minutes. Optimal is like half an hour, but nobody will ever do half an hour. So it's just 10 minutes, 15 minutes. And actually, I was just thinking, and I was going to ask one of my meditation experts, why don't we combine humming with meditation? So you
Yeah.
just think about your tone of voice while you breathe, because you take a deep breath, you keep it in, and then when you expire, you just do the humming.
Yeah, yeah.
Maybe that would work.
Yeah, actually, now when you're talking about it, I'm kind of thinking if when we are talking about the sadhus and sannyasis in India, they would do the meditation along with the with the Om, chanting
See?
of Om. Yeah.
Yeah.
So
Everything we go back to our ancestors, we go back to, everything that they used to do was the right thing.
yeah, yeah.
So we're just going back. So the most important thing about humming is that it improves the chronic sinusitis, because it moves the stagnation in your sinuses. Okay, so it moves the ciliary muscles to get rid
Mm,
of the secretions from your sinuses, providing that you're eating right. We can
mm.
talk about this later, but it increases the nitric oxide in your head and
Right.
neck. And the nitric oxide improves the oxygenation of this area. And now
Mm,
there is like a recent data about giving patients with COVID-19 nitric oxide to improve their oxygenation. It acts as an antiviral, and it actually vasodilates the
that's-
vascular system, so that
mm,
they can, because one of the things that makes COVID-19 patients at risk is low oxygen in their alveoli, not poor oxygenation.
mm, mm.
So the humming, it improves the chronic sinusitis, it increases the nitric oxide, and the nitric oxide now, it has an antiviral effect, and it improves the oxygenation of the upper respiratory tract.
Yeah, yeah. We got that now. Perfect. Now that's brilliant. And coming to the nutrition part, and also I'm kind of a little bit wondering about, we're using a lot of sanitizers and we're using a lot of cleaning agents constantly. The impact on the gut, and we all know the gut-brain axis. We are stressed. The constant onslaught on our microbiota, and the link between that. Are we heading towards a long-term chronic condition, chronic mental and physical condition?
Yeah. Well, I am worried. So regarding the sanitizers, they don't enter my house. So
Mm,
what I do is just wash your hands with soap and warm water. Because like the virus and the cell wall for the lipids, and then the hot water, all these
yeah.
things. However, it's just when so I don't get like the disinfectant soaps at home.
Mm,
If you want to disinfect something, so you just disinfect the surface. If you have people coming over, but not every day, like not like a daily disinfectant, because if you live in a sterilized bubble, you will not be encountering any microbiomes,
mm,
and then your immune system will go down,
yeah, yeah,
along with disrupting your microbiota, where 80% of your immune system happens in the gut. So
exactly.
so basically, no alcohol whatsoever, unless I'm going out and I'll be going to several places urgently. So I will be having like the alcohol gel or spray with me. I would like, after finishing, if I go to the clinic and come back, I would just wipe my hands with the alcohol before getting into the car. And then when I enter the house, I just wash my hands with soap, warm water and soap, and sing happy birthday for twice, for 20 seconds.
This is what I absolutely love about you. Now, we talked
We just have to get
when
some
we are
sense
talking
out
about,
of it.
and that's why all your lectures are so interesting. You absolutely done it with the jokes and make it lighter. When from the microbiota, obviously we're moving towards the gut, and you talk a lot about the eating a rainbow. And absolutely, I always tell people it's not about not like telling kids in primary school, in junior infants, that eat a rainbow. It's actually adults as well. In the clinic, I actually had to tell people you need to monitor the colors. So,
Yes.
but yeah, like you do talk a lot about that. So the 5 colors of phytonutrients, and if you could if you could explain that more.
Well, it's just amazing because you have everything you need in food because food is information. So when I first the first lecture, I don't know if you attended my first lecture. It was about how to reprogram your health or how to reprogram your.
No, I think I was traveling for work in India that time. I missed that one.
No, so the thing is that food is information. So in order for you to reprogram your software in order to work better, so you need to give them the right information. So when you're eating bread, that's for the immune system to support your urinary tract infection, DNA health, heart, and even anti-cancer. So all the colors basically are anti-cancer because they're filled with phytonutrients, polyphenols, and flavonoids. So the red lycopene, ellagic acids, like in the tomatoes, in the pomegranates, in the raspberries, in the watermelon, those are extremely important from the red point of view. You have the orange for the reproductive health and the ovaries. You have the yellow for the digestive health. So because you have the pineapples with the bromelain, you have the papaya
Yeah.
with its enzymes, you have the ginger, you have the curcumin.
Yeah.
So those are very good for the digestive system. And then you have the green foods with the chlorophyll. And I always like the chlorophyll for the plants is like the mitochondria for the human being. So you get the energy that happens like the Krebs cycle. It's from the greens.
Yeah. Yeah.
So when someone has like low energy, his blood vessels are not pumping properly, etc. One of the most important phytonutrients is the sulforaphanes. Because the sulforaphanes they act on the nerve2 gene, which is anti-inflammatory. And one of the most important thing now is that to suppress and put off the fire in our body in order for the immune system to work properly if it encountered any virus or invader coming into our body. And then you have the purple one, and then the white for the detox, where you have, and the immune system. We have the mushrooms with the beta galactan. You have the cauliflower with the sulfur, the onions, and the garlic.
Garlic.
Yeah, the allicin, you call it allicin, and the quercetin, of course, where with the functional medicine approach, they summarize the importance of quercetin, 500 milligrams per day, even up to 1,000 for as being an anti-COVID. And COVID, the quercetin, you can find it in capers, onions, apples, asparagus, and even fresh cilantro. So it's very important that we have all these tools in our kitchen and we're not using them.
Yeah,
absolutely. So you
absolutely.
always aim for two colors every day. So if you have like a salad made from beetroot, some coriander, some tomatoes, carrots, and like mushroom and garlic, you've got yourself like a bunch of colors, and then some vegetables beside them. So I think it's very easy if someone concentrates in what's going on, in what he eats, that you can get the colors into your system.
And it's very important even now in this kind of scenario. These micronutrients are just so important.
Yes, absolutely, absolutely.
Yeah. And you did talk about, I know, the whole traditional way of eating. And I remember the very first few classes of when I started studying nutritional therapy, I realized that when you talk about the bitters, right?
Yes.
Taking bitters before your food, before your main meal, so that the gastric juices come.
And the bile. And the bile as well. Yes.
Exactly, the biles. And so what I was saying that, oh my God, in Bengali tradition, you have to eat bitters before you start your meal. And we never knew that had a scientific explanation.
You go for the French fries, you go for the nuggets. Because it's the easy to prepare and easy to swallow, and they have like loads of MSGs, the glutamates. So that's why we're seeing, like, we're raising incidences of autism and all these other chronic diseases.
I think we need a very long discussion with you, because people need to understand this from the scientific perspective. It's not a scientific perspective of food, to be honest. Now, just coming back to the work you do, which is really very serious work, and but in the current scenario, we know that patients suffering from cancer are at greater risk of contracting the virus.
Yes.
However, there's no clear understanding as to why this is the case, and there are some cancer patients that are particularly at higher risk than the others. I don't know if that's the case, and why is it that they're at such higher risk?
Yeah. So cancer patients, they're immunocompromised because of either the chemotherapy that they're taking, or the post chemotherapy period where the chemotherapy has been like accumulated in their bone marrow, causing bone marrow suppression. So so it causes not only like low white blood counts, it causes problems like thromboembolic problems, and this is a problem with COVID-19,
Yeah.
the thromboembolic manifestations, and then even so it causes like an overall defective mechanism of homeostasis. Unless that person with cancer is like taking his conventional treatment along with a metabolic approach against cancer, where he can fine-tune his immune system in order to recover from the treatment faster, and fix or modulate the epigenetic expression of their genes. I know this is complicated, but let me just like simplify it a
Yeah,
little.
for the
Yes.
for the listeners, probably you need to, yeah.
So when I talk about reprogramming your health, so you have your genes, I have my genes. You have your environment, I have my environment. And so they say that the genes, how do you say it?
Expression. Think about the
Gene
gene.
loads the gun. So the genes load the gun, and the environment pulls the trigger. So let's not talk about like this person has a genes, and that person has another gene, and they like the twins. You know, when the two twins, one was living here and the other was in the space with NASA, and with their
Yeah.
environment, they had different
Yeah.
gene expression.
Yeah.
Okay. So we all have SNPs. SNPs is single nuclear polymorphism, which is
Yeah.
changes or mutations in our genes. Like 50% of us have something called MTHFR gene mutation, which is the inability. You too, okay?
No, I am very scared to get that MTHFR SNP tested, because I'm terrified. I think I have it. But
No, it's just 50% of people have the
yeah,
MTHFR. Well, it's more like impactful if you have the COMT as well. But
yeah,
but however, like I told you, genes don't make our destiny.
yeah. That's
So
the biggest thing.
yeah, so you just modulate them. And how do you modulate your genes? With food. So if that person has MTHFR gene mutation, so he will not be able to utilize the folic acid. He has to get it in a folate or a folinic form. So if I have like cancer patients, some of them have MTHFR, some of them has the BRCA gene, some of them have another tumor suppressor gene that has gone bad. So it depends on which cancer and which genetic profile of that person who will be more prone to get the cancer. If they encounter the COVID-19, they would recover faster or not. And so if you have a patient with COVID-19, you should just look at a couple of things. You should look at their age, their comorbidities, and their lifestyles, and any unnecessary source of inflammation.
Yeah. Stress is a big source of inflammation.
And that's the lifestyle. So lifestyle, we talk about de-stressing, we talk about exercise, we talk about sleep, we talk about eating right, and hydrating.
Yeah.
And not hydrating with Coke. Not hydrating.
Oh yeah.
Yeah. So that's basically
Absolutely.
the clotting and the high fibrinogen and the immunocompromised cancer patients, when if they encounter, God forbids, COVID-19 as well. I think that they might probably, according to their age and other comorbid diseases, they might be having a rough time recovering from it.
And Doctor, my last question. I know I wanted don't want to take up too much of your time, particularly during the Ramadan time. You just broke your fast. Um, just last question is, depending, somebody say has recovered, so have been given all clear with their cancer. Are they at high risk as well?
Well, there have been papers about or like announcement about reinfection, but
Mm.
I don't think that it was a reinfection rather than that the PCR was done in the wrong timing.
Sorry, I meant recovered from cancer. So they got
Ah,
all
from
clear from
cancer,
cancer.
sorry.
Yeah, we can actually talk about the recurring of COVID as well. You've brought up a very interesting point, because now we are going into out of lockdown and we are gradually planning to go back to work. And that's a very we can tackle that. But if you could just talk about the recovered cancer patients first, and then we can tackle
So,
the other.
yeah, so a cancer recovered patients, it depends. If that person did surgery, did the chemotherapy, his scans are negative for cancer. It's tricky. You should always consider the age and the comorbid conditions as well,
Yeah.
because if they didn't change their lifestyle
Mm.
and take a metabolic approach, take care of their immune system, of their hormones, of their gut microbiota, of their mental health, the cancer will eventually come back, because the cancer stem cells still live in that microenvironment of body. And that's how he encountered cancer from the first place.
Yeah. Yeah. Okay. Yeah,
So,
absolutely.
so, so all cancer patients have to think about changing their microenvironment upon which cancer has happened. So if they have a trauma, they need to resolve it. If they have a bad estrogen metabolism, they need to resolve it. If they have high stress, they need to change their jobs. Okay? So I'm sorry, we all have high stress, but it's just that if you have high stress and you love your job, that's a different thing. You just want to vent, to ventilate, you vent it out. But some people, they're just stuck in the job for instance for the money,
Hmm.
and they just work day and night without like they having the passion towards that work. You detox from bad friends who like whenever you see them they just tell you bad stuff. So there are a lot of aspects that impact the life of a cancer patient, so they're very vulnerable.
Yeah. Yeah. And the last question then, Doctor, you brought it up about the whole, we are all terrified that whether there will be a relapse or what's the story, because we are very, personally, like in our company, we're very small, but we have decided that we're not going back to the office before at least August, September. So, what's your view on that? You did mention the PCR.
Yeah, of course. So the thing is that I don't know if the herd immunity is something like in our best interest or not, because you and me have locked ourselves up in our have locked ourselves inside our house. Okay, we just go out for like running a very like important errands and come back, sanitize ourselves and stay at home, and we're being very cautious. But you don't know what the rest of the world or the people in your city are doing.
Mm,
So awareness is key,
mm,
education, and we just keep the distancing, because I think that there are a lot of people walking amongst us without symptoms.
yeah.
Mhm. And if we keep locking ourselves inside our homes, I know that this is like the most safe thing to do, but you won't be exposing your immune system to any other microbes, because this is how the immune system gets better, with good food, with exposure, so that you can have antibodies, etc.
Mm, mm.
So I am scared, especially because I have a couple of friends who passed away from COVID-19,
Oh
and
my God, I'm so
those
sorry
were
to hear
medical,
that.
and this that was like that made me and my husband, who's actually a neurosurgeon, he goes like every other day, he goes to the clinic, he does emergency surgeries, so he's at a higher risk of exposure. And then he comes back home, so it's as if I'm going out.
Yeah, yeah. Yeah,
So
I mean, the doctors are doing phenomenal job. To be honest, you're the heroes, and you have two in your home.
so thank you. But the thing is that so I think that we are being exposed to sub-minimal or subclinical doses of viruses because of gracefully my husband coming back from the hospital. However, I think that we should be going out, but avoid crowded places, keep the distances, and if people just practice those, like we can call them like etiquette, you know,
Yeah,
the word etiquette.
yeah.
Yeah.
That's
So just keep the distance. Don't hug everyone or kiss him a thousand kiss when you see him. You know, just say hello, or don't
yeah.
even shake hands. Say hello like this.
Yeah. It
Um,
might be very difficult for you next week when it's Eid.
no, don't worry. I'm keeping this. It's like we will just Zoom. Yeah. So if you want to come back to work, then there is the IgG, the rapid test, which is the IgM and IgG. They are the not so much expensive. The IgM, it indicates that you have an infection right now, and the IgG, it indicates previous exposure to infection. However, it depends at what time of the infection. If you had it, you made the test. The most sure one is the PCR, which is extremely expensive. That's why it's only in the hospitals when they
Yeah.
have a patient coming and suspected for COVID. So I don't think that we will be keeping in this lockdown for a very long time. We can go out, but we should just keep the distance. Not go
Yeah.
to a what Egypt has decided to do, that they're going to like we can go out. However, they will keep the restaurants closed. They can do just take out or delivery, and they will keep the I don't know about school because they haven't decided yet. But in Swiss, I have my friend there, Patricia Daly. She's Irish. I know you know her. So
Yeah.
Patricia Daly, she told me that they're bringing kids to school 2 days on and 2 days off. The ones at home, they will be doing the virtual classes.
Okay.
Because we're suspecting, like, if we passed October and the next winter safely, then we would know if there would be a second wave or not.
Yeah.
Mm. But now it's winter in Australia, so we should be looking out for how
For sure.
Australians will be handling the
Yeah.
situation. Yeah.
Yeah. So we are on for a long haul. Thank you
Yeah.
very much for this. I cannot thank you enough. I know how busy you are. I'm trying to be one of your clients, and I know you can't accommodate me. We have to do it. You have to tell me when you're free, and I'll have to
No,
get myself on the road.
it will be, I'm working on restructuring the clinic, and
I know.
hopefully,
We're
hopefully
giving you time.
you are the first on the list. Don't worry.
Thank you so much. Thank you so much, Doctor.
You're
I'll
doing a
talk.
great job, and like it's fantastic for you, like, to spread the awareness like that.
Thank you so much. I'll talk to you soon.
Sure, sure. Take care.
Thank you. Bye.